Hi, I'm Dr. Mike Stierstorfer. I'm a dermatologist and the developer of IBS-80. IBS-80 is a new approach to IBS that puts a tried and true procedure in dermatology called patch testing to a completely new use to identify food allergies that may be causing your irritable bowel syndrome. In this video, I'd like to tell you more about the testing and how it came about. It all started on July 3rd, 2008, when I had lunch at a restaurant that I hadn't been to before. Afterwards, I developed mild stomach pain and nausea that I thought would go away, but over the next few months, I had an upset stomach about half the days. An extensive evaluation by a gastroenterologist didn't find anything, and I was diagnosed with IBS. About a year after the symptoms first started, I finally noticed that I seemed to flare up whenever I ate anything with garlic. It was the first time I definitely noticed something I was eating that triggered the symptoms. So at that point, I intentionally avoided garlic, and almost magically, the symptoms cleared up completely within a day. Now, as long as I avoid garlic, I have no problems. What most people don't realize is that you could become allergic to something at any point in time. It doesn't have to be something new. So it seemed likely that I had developed an allergy to garlic. As a dermatologist, I fortunately had the training and resources to look into it further. I first got tested for the type of allergy that you hear about from peanuts, but that involves needles, and that test was negative. It turns out that type of allergy testing is generally felt not to be useful for IBS. At that point, I decided to look for a different type of allergy by using a test that we dermatologists traditionally use to evaluate skin rashes. It's called a patch test, and I decided to do it on myself to look for garlic allergy. The patch test resulted in a red, itchy spot on my skin, meaning there's an allergic reaction in my skin to garlic. This turned out to be a very important observation. The lining of the intestine is very similar to the skin, and it's likely the same allergic reaction was happening on the inside whenever I ate garlic, causing my IBS symptoms. Since patch testing for IBS had never before been done, I decided to investigate whether others with IBS might have similar allergies. Over the next 10 years, I developed a series of patch tests to test for allergies to over 100 different foods and performed 2 published clinical studies. Both studies supported the hypothesis that food allergies detectable by skin patch testing cause irritable bowel syndrome in a significant percentage of people who carry this diagnosis. These findings represent a major advance in the understanding, evaluation, and treatment of irritable bowel syndrome. On the basis of this work, IBS-80 is now available as a new, safe and painless way to screen for food allergies that cause irritable bowel syndrome. If you have an allergic reaction to any of the tested foods, by eliminating them from your diet, your IBS symptoms may improve or may even completely disappear. If you're among the 30 to 45 million Americans who suffer from IBS, you know how frustrating and disruptive it can be. So do I. I'm hopeful that IBS-80 can help you. To learn more about IBS-80 and to find a provider who administers it, visit IBS80.com or ask your doctor.